Our November Trust Board meeting. For those who might be watching today's board, my name is Caroline Flint and I'm the Trust Chair, and this is the public part of our deliberations today. Can I also take the opportunity before we start onto the agenda items to welcome Rebecca Johns Bealey, I think, or Biley. I hope I've pronounced that right, Rebecca. Rebecca is an emergency planning officer and she joined the 2022 High Potential Development Scheme, and she asked her executive sponsor, Steve McGowan, if she could observe today's board, which I was really pleased to say yes to. So welcome, Rebecca. Glad to have you with us. Look, I'm always presume everyone's read the reports, and I hope presenters can speak to the key aspects for attention, discussion and approval. I want to allow maximum time for Q&A, and I am hoping to finish part one by around 11:45, so we can start part two at 12 o'clock and finish by around 1:45 today. So we'll have a comfort break at 11 o'clock for the public board meeting, but I just wanted to flag that at the start so everyone's conscious of what we are working to. So let's start onto the agenda then. Apologies for absence. I haven't had any apologies for absence. Jenny is indicating I'm correct on that. Thank you, Jenny. Declarations of interest. If there's any changes to your declarations of interest, please let Jenny Jones know. And if there's any items on the agenda for which there's a conflict of interest, please alert us to that. Anybody want to say anything on this? No, thank you very much. We'll move on to the minutes of the meeting held on the 26th of August. Are there any amendments or corrections to those minutes, please? Francis.
Just a very minor one. I just noticed it on the declarations of interest. It talks about the Chief Exec and Director of Finance on the Collaborative Committee. Should it also talk about Stuart and Mike?
Oh yes, that might be a good idea to have some sort of consistency there. Shall we take that away and just revise that if it's appropriate? Thank you for that, Francis.
To the private meeting, Caroline, as well, because I noted that.
Okay, thank you very much. Jenny will be taking a note of that, and we'll make sure that's amended as needed. Thank you very much. Anything else on the minutes at all? Do we need to reflect in the minutes that there was a discussion where we discussed the quality of care, particularly Edenfield? There was a change to the graph that had to was sorted out in between meetings. This was on point. This page 6. It was on point 205/22.
I think we should.
Yeah, so let's have that reflected in the minutes, because that was a takeaway from the last meeting, and I know that work was done. Thank you, Hilary, and your team for sorting that out and clarifying that. Okay, I can't see any other hands up, so we'll accept that as a correct record. And if we may, could we move on to the action log and matters arising? Any points from the action log colleagues would like to mention? No? Okay, thank you very much indeed. Moving on then swiftly then to the staff story, and I'm really delighted we have Gemma Cartman with us today, who is going to talk to us about being Humber. I know everyone probably has seen the new guidance and document that is available. I think it's a really good document. It's really clear and accessible. Gemma, welcome. Steve, did you want to say anything before Gemma introduces herself and guides us through the staff story?
Thanks, Caroline. Yeah, no, just to like you welcome Gemma, and also I know Gemma, you've climbed off your sick bed to be here as well. So thanks ever so much. I really do appreciate that. I know it was touch and go like yesterday, so thanks for doing that. Yeah, Gemma will talk about her experiences. She's been with us in the OD role now for well, it feels like a short time, but I'm sure it's a little bit longer than that, Gemma, and has led all the work on the Being Humber. So she's part of our staff story, and I will hand it over to Gemma, who will tell us about her experiences with Humber and the team.
Thank you, Steve. Over to you, Gemma. Welcome, and you've beyond the call of duty, I would say, coming today. Thank you.
Morning, thanks Caroline and Steve. So yeah, I'll just apologise for a little bit of a croaky voice. I've just got sort of coming back from flu at the moment, so it's been a few days of feeling a bit sorry for myself and lots of Christmas films, which haven't quite done the trick to cheer me up yet. So we'll see how we get on. But so thank you so much for having me. It's great to be in the platform today. I've not been to one of these before, so it's nice to be here. So just a bit of a morning welcome, and for anyone that doesn't know me, so I'm Gemma Cartman and I work as a senior organisational development practitioner in our OD team, so under Steve, and it's my role to just support colleagues across the trust in finding the right development opportunities for them, and in line with our values. It's just really important to me that everyone feels they've got a chance to grow both personally and professionally when they're with us. And so a little bit background of my sort of journey or career journey has been I started in training. So I spent years outside the NHS, sort of progressing my way through a training career. And I'd mostly been at the front of classrooms, sort of training colleagues to be the best that they could be in a range of topics, from finance to dealing with suicidal clients, lots of different background stories. But over time, I just clocked up endless hours of designing, delivering and evaluating training. And I'd always been interested in a career in the NHS, and mainly because a lot of my school friends at the time had gone into clinical roles and they'd been in education for a few years, but I'd not gone down that route, and the NHS just felt so big and alien, and I'd hear all about their stories and I'd be really interested. So I just kept my eye on recruitment and on the kind of NHS jobs websites to find out what was going on. And eventually a role came up at a local trust, which wasn't Humber. And I joined the acute trust during the height of the pandemic, and I joined the engagement and development team. As you can imagine, during that pandemic, being with frontline staff, it was just a really huge challenge at that time. And if I'm really honest, I actually really struggled to settle in that role. I just didn't feel that the team that I worked in had a clear vision of what we were trying to achieve and to how to support our staff on the front line in a really difficult time. So through chance, I saw my current role here at Humber being advertised. And initially, I just started researching our trust, and I really easily came across our vision and values online. And my first impression was this trust just really seems to care about its people. And I really liked that there was a clear statement of what we were working towards. So I decided to apply and came for the interview. Once I found out that I was successful in obtaining the role, naturally very excited but nervous to kind of leap into a new trust. But I was ready for the challenge, and on joining Humber, I received such a lovely, warm welcome, but also really prepared. Everyone knew that I was coming and everything was ready for me, and there was a clear vision of what we were trying to achieve in OD. And as I was going through introducing myself to lots of different colleagues, I came across even people that had actually left Humber and come back and said it just wasn't Humber. And it just really stuck with me. I really liked that line that people kind of had a sense of, I know what Humber's like, which just made me feel I'd made the right decision in joining. So one of the early projects that I was asked to work on was just reforming the behavioural standards that we had. And the document that previously existed, the feedback was it just didn't feel fit for purpose. They didn't have the right tone or approach. And there was even colleagues that just didn't actually know what to do with it. They knew it was there, but didn't know how to actually put it into practice. So behavioural frameworks, in my experience, are just such an essential part of capturing the culture of an organisation, and it just defines what we find acceptable and what we don't. So I wanted to start with doing some research, and from that, the kind of journey began of working with colleagues to collate the feedback and work out what we wanted our new behavioural framework to look like, and also define its purpose. So it kind of started with working groups, and that consisted of colleagues from different areas across the trust, all making suggestions on what the product should look like. We spent quite a substantial amount of time researching what other trusts had in place, and even organisations outside the NHS, just looking at what does good look like, what doesn't look good. And we found some examples of what we felt were really good and what we felt were poor. And then we basically got in with our equality groups. We liaised with clinical roles, corporate roles, all at varying bands, and just gathered the feedback. And the feedback for me was really invaluable because it just helped to create that final version of Being Humber. And the kind of tagline that I wanted to share is that the Being Humber framework it's our colleagues' words captured to build what they want to see from one another. So the final framework was successfully signed off through the operational delivery groups and through the board meetings. So hopefully everybody's seen it and familiar with it. And that's where our launch began. So I've worked a substantial amount of time with our comms team, who have been absolutely fantastic in making suggestions on how we really get this out there and make sure everyone knows it exists. So we've had a lovely launch video that's short and snappy. That was our kind of initial start. We've reformed our intranet page. We've had regular slots in our news outlets, so the Global. We've had it in our EMT news stories. But overall, our main aim, and will continue to be, is just making sure that Being Humber is easily accessible for everybody, and that people know it exists. So the new behavioural framework's been live for 1 month now, and I've been on a bit of a roadshow, and I'm continuing that roadshow to just engage with colleagues across the trust to just show them what that new framework looks like, and actually encouraging them to get involved in where can they use it. So rather than going into meetings and saying you need to do this, I'm doing a bit of a workshop where I'm saying, where will it be successful with your team? What does it need to look like? And that engagement's been a bit of a much more two-way conversation, which has been lovely to be involved in. We've seen some absolutely excellent stats of colleagues actually reviewing the framework. So sort of 4 weeks in, we've had over 600 visits on the intranet page. We've got 67 people every day visiting the intranet page and spending around 5 to 10 minutes on that, which is great engagement when we know we're really busy. The leaders are feeding back to us at the moment that they're feeling more supported in challenging poor behaviour and celebrating the success of their team members. And for me, the new communal language just lays out what behaviours are expected from each other, and it's essentially captured a little bit of what it's like to be Humber. And it kind of comes back to that statement of it just wasn't Humber. We've got something that captures that now of what it's like to be us. We're only just getting started, so we're going to continue to embed this in everything that we do. And kind of going forward actions for me are going to be working with recruitment, helping complaints, and inducting new staff. So really threading Being Humber into everything that we do. And I'm really proud to work for Humber, and it feels great to be a part of a project that's helped us to empower our colleagues to challenge areas of improvement, but also champion and celebrate the success. So that's a little bit about my kind of journey at the moment, and I believe I open it up to the floor for questions now. Is that right?
That's right, Gemma. Thank you so much for that introduction. And I personally, I just think it's really helpful to have this work being done, because I think, as Michelle Moran, our chief execs, reminds us all, we pretty much do everything apart from acute in our trust. And it's and also, as Michelle says, we cover an area the size of Belgium as well. And so how you connect different groups of staff, obviously in the NHS, but working different parts, I think this is an important contribution. That and just to feed back, and Steve will be pleased about this, is on a recent visit to a GP, one of our GP practices, I was really pleased to hear staff spontaneously tell me how much the Proud programme had been really helpful, but also how it connected them to people they didn't really see in their everyday working lives at the trust. So I think this is another really helpful contribution to that sense of connectivity as well, I hope too. So thank you for your work. So over to questions, and the first person that I have, let me just check on the list here. Sorry about this. Why isn't this coming? Francis, and then Stuart, and then Dean, and then Hanif. Francis.
Hi, Gemma. I'm Francis, one of the non-execs. Great presentation, some really good work. A couple of quick questions from me. Obviously, you've come from industry into the NHS. So I'll be interested on your views as to how we compare to what you experienced in industry, and your initial view that you said you looked on our website and it looked great, how that has crossed into reality. And then two quick ones. How are you linking it to appraisals? So are we going to be talking in appraisals about how we've evidenced the behaviours? And then you talked about over the last month, some people have been giving some examples. Just wondered if you could share one or two.
Yeah, absolutely great. Thanks, Francis. Great question. So I think my initial transfer over from industry into an NHS body was a huge shock, if I'm honest. I think it was a huge culture shock because I think, as I said before, my experience with the NHS was very much kind of stories from people that worked there, be friends, family, different things like that. And I always had this vision that no matter what kind of NHS body it was, everything was the same. And when I came in and realised there was all these different, there was an acute, there was different services, and it was quite a lot to take in at the time. But I think the thing that kind of stuck with me, the biggest difference, is that the NHS is something that my experience has been that we're just open to new ways of working. So we're constantly kind of striving for how do we improve, how do we make it better. And in my experience in other industries, it wasn't like that. It was very much how do we just, it was the focus wasn't on the service, it was on profit and how do we make the most money and how do we and so that was a really nice kind of culture change for me, to be a part of putting the patient and actually making the service better. So that was the kind of biggest change for me. In terms of how the values and things have transpired for me, absolutely have. I think the research that I did about the trust and finding the values, the vision, it's something that, being a part of OD, we live it and breathe it every day, and we're trying to get that out to everybody else. And I think for me that they have been there, the values of even down to ask the execs and things like that, the everybody kind of works towards supporting those. So definitely live and breathe it for me. And then sorry, what's the appraisals? That was the final question, wasn't it?
Appraisals and then some examples from over the last month.
Yeah, brilliant. So absolutely work towards embedding this in appraisals next year. So we'll be weaving the Being Humber kind of language into the appraisal form and making sure that that's really consistent. And we're looking at how we can potentially create almost an assessment tool that colleagues can almost do a bit of reflection on how Being Humber are they. So if they're maybe struggling to find their own development points, we're looking to implement this assessment tool where they can work with the leader to do a bit of reflection and work on where are the strong points and where are the focus areas, and then that can transpire into their appraisal in setting some objectives. So we're working on that in the background at the moment, and it's been a really exciting journey to be involved in, because we're consulting with different members of staff, getting feedback at the moment, and people are really responding to it very well. They've not had anything like that before, so we're excited to embed that. So, and then in terms of examples, I think the biggest one at the moment is the difference in the kind of biggest response I've had is probably the recruitment team at the moment. So we're working on how do we weave Being Humber into our initial interviewing process. So when we actually interview staff, how can we test that their values work and that they'd work within our trust? So we're currently the example is that we're building a template, and recruitment have been a huge part of that. Myself and the business partners, we're all working as a little sort of cohesive team to build a new interview pack and get that right from the set off before people even join us.
Great, thanks.
Thanks, Francis.
Thanks, Gemma. Stuart.
Yeah, hi, Gemma. I'm Stuart. Hi there. I'm one of the non-execs as well, and really think the work you're doing is very important. I think the way people work and how they work together is so important to any large organisation. Just a couple of things for you to take comfort from. I chair the audit committee, and the last audit committee on the 8th of November, at the very end of the meeting, I brought up the kind of the summary template of the the definition of being Humber. We had a quick check to see whether we had been Humber, and generally we thought we had, although when it came to the one about recognising and looking at diversity, we weren't sure we had any positive evidence, no negative, but positive evidence. We were struggling how to kind of elaborate on that. My question but I think the framework's really good. It's very clear, easily understood, and it's one of the things where you can't really disagree with its content. However, some people won't behave in accordance with the what we're looking for, and I wonder if you have a view on your sense of whether people are willing to speak out, to call out bad behaviour, if you like, or unacceptable behaviour. Do you have a view on it?
Yeah, absolutely. I think it's something that naturally it's always going to be a bit of an uncomfortable conversation. It's going to be difficult. And at the moment, the target audience we're helping and supporting with that is initially the leadership group, on how we help them and support them to engage in that difficult conversation, and using the framework as a tool to start that conversation. So if they don't feel someone's been Humber, that's what the quick guide was. That's the vision of the quick guide, is that's something really easy to pull out and sort of say, can we have a conversation about this and reflect on that behaviour. But the vision going forward for me personally would be that it shouldn't just always be coming from leaders, that we should feel comfortable to, potentially challenge our colleagues if we feel that they're not being Humber. And so I think the goal is to build the confidence with that, and that's what that communal language that I'm referring to is, that we've got this framework that can sort of start that engage in that conversation. And it hopefully builds confidence for people to rely back on it, and it's a tool in the toolkit for people to pull out. So
yeah, and I think the choice, whether it's deliberate or not, I think the device, the phrase being Humber is a clever one, because you can easily turn it into, well, hang on, you're not being very Humber there, or something like that. It's easily translated back into a riposte, isn't it? Which I really like. So yeah, well done, and well done for coming this morning. I hope you recover yourself.
Thank you. Thanks, Stuart.
Thanks, Stuart. Dean.
Thanks, Gemma. My name's Dean. I'm also one of the non-executive directors, and Francis and Stuart have pretty much covered what I was going to say. So I just wanted to just say that it was a great presentation, and what was really nice was just the way that it sort of resonated with you personally. It's good, isn't it, that there's a sort of common language across the organisation, whether you're a clinical, hands-on patient for those vital support services and administrative services that support. And it was just lovely to hear you say at the end about being proud of your work and that sort of important connection. So thank you for the presentation. Well done.
Yeah, thank you, Dean. Appreciate it.
Thanks, Dean. Hanif.
Thank you, Chair. So Stuart covered part of my my question on the diversity, but as colleagues have said, great presentation. I was just interested in hearing that you'd done this comparative exercise just to see where we were positioned, and what you might have found in terms of best practice elsewhere that we're currently not undertaking, and that you might be looking to implement within your work plan.
Yeah, so I mean, the examples were so varied when we looked around, and there was, I mean, naturally, I'm always nosy in what the trusts are up to and what they're winning awards for, because we want to win awards as well. So I'm always looking at their kind of good examples. And some of the examples that we came across, what they did have was almost an extension into that, assessing performance and behaviour, and in one-to-ones and appraisals and things like that, which I think something like that always it kind of reinforces a framework. But then the feedback that they were getting, so I engaged with one trust, and they sort of said they regretted implementing having performance measures each month relating to their framework, because people felt that they were constantly justifying, they were just coming to work doing their job. So as we kind of explored all these different frameworks, there were so many different ways people had implemented them, and that's, again, it comes back to that. It's almost quite strange how we've got so many different trusts doing lots of different things, that there's not necessarily an element of consistency, but what works well in some areas isn't working in others. In terms of kind of what we want to build, I think the assessment tool was inspired by giving people the chance to reflect on their performance. So coming back to that, almost assessing behaviour rather than implement it in one-to-ones and a mandatory tool. It's become something that's a reflection tool that should be used to help development conversations and more of a support tool rather than a mandatory tool. So that's something that's definitely in the vision to kind of compare with what other trusts are doing. But the kind of biggest thing I think that we took from looking at other trusts was a lot of, or even organisations outside the NHS, they were quite patronising, and that was something that we really wanted to avoid, because we hope that frameworks aren't something that we hope to necessarily have to constantly talk about, but we know that sometimes we do need to talk about it when behaviours need to be challenged. So one thing that was really key that we took away in comparison to others is making sure that that language didn't feel patronising.
Thanks, Gemma. And finally, I've got Michelle and then Steve. Michelle.
Yeah, good morning, Gemma. Thank you so much for the work. And I think, as I've mentioned all the way through, this is a really important piece of work for the organisation in our cultural journey that we've been on. And I think, your enthusiasm shines through, but the amount of work that it's taken to get here, I understand is really phenomenal, because I think it is about the language that we use. And I think you've touched on a little bit of that in relationship to patronising. So the language is so important. And I think what shines through the being Humber bit is that the language is really helpful, so that you can start that appreciative challenge conversation if you need to, because that's the whole idea. We talked a lot about Edenfield last time, and I'm sure we'll touch on it again today. And I think as you related around the recruitment piece, it starts with the people in our organisation, about treating ourselves and others how we want to be treated ourselves. And I think that's what about being Humber is. So I think that is really important, and linking it to appraisals, linking it to this meeting all the way through the organisation. It was great. I was at audit committee and we did, and I'm sure the chair today will end up with, have we been Humber today? So I think that's really, and we need to continue that, because for me it's not just a campaign, it's going to be a way of life. So one of the things I've asked Stella and others to do in the new year is just look at how we're using our branding, our being Humber, etc., and where do we need to support people in relationship to that. So that's fantastic. I also want to say, obviously we've got a menu, as you mentioned, on the intranet, but we're going to get t-shirts, badges. It's going to be all the way through and on notice boards, so it's going to be sort of front, middle and centre. But fantastic. I could go on forever because it's so important, this work in relationship to our patient care as well as supporting our staff. It's great that you're proud of them, fantastic. And I do meet lots of staff actually that say, oh, we were left and we came back, and somehow we've got to capture that, I think. And we need to probably work with comms about how do we capture those stories that people have gone and come back, because it's not Humber. And I think this is a start, but I could go on because it's so important. So thank you so much. Absolute pleasure. Great presentation. Great work. Let's keep going on it. It is so important and it's making a difference.
Thank you, Michelle. Steve.
Thanks, Caroline. Thanks, Gemma. Really good presentation. Just a couple of bits from me. I know, I mean, it's great because Becky's on the call today observing as part of the Humber High Potential Development Scheme, and I know that's something that's really close to your heart as well, and you've done a lot of work in working with the staff on that and nurturing them. So it's great that you kind of come to one when Becky's there. That feels like it feels like it's all the stars are aligning. So you've made a great start to your career with us. Well done. I think certainly something I take away from the way that you've presented today is, and I know you're working with teams and departments across the organisation, and your style is one that just comes across as being really natural and one that will fit in really well with helping to work in development with teams. And I'm sure everybody that's listened to you today gets that kind of confidence and assurance as well. So Gemma, well done. You've made a brilliant start to your career. You fitted in great in the team, and well done on what you've progressed so far.
Thank you, everyone.
Thank you, Steve. And just to end up, Philip's put in the chat box about, this type of framework is to encourage a positive, inclusive culture. Performance managing it too much would diminish it, in my view. And I think there's a lot of people who've put a thumbs up for that on the chat box, which I would agree with. It's actually something we want people to live and breathe. Not just something that's a tick box exercise. It's how they feel about an organisation, which is so important when our staff are talking about their work with others who we'd like to join our organisation as well, maybe in the future. But thank you, Gemma, so much. And it's a month in, and it will be great at some point to have another chance to have a chat about how things are going. So thank you so much, and take care of yourself. Wrap up warm. Yeah. Have a nice hot drink and look after yourself. Thank you so much for making time today.
Not a problem. Thank you, everyone.
Cheers, Gemma. Great. Okay, lovely. So let's move on then to the chair's report, my report. I've done a written report this time. I'm not going to speak to everything on it. Of course, it was an absolute joy in the last month to be able to share with colleagues who were finalists for the Health Service Journal Awards, of which 2 of them were highly commended. I know Michelle might pick up on that on her report. But I mean, just being there, it was just amazing. And to have 3 groups of our staff involved in the finalists here was really great to share with them some of what they've been doing and the hard work they've put into it, as well as all the other people in the trust over the last year who've done a huge amount of work, and it's been recognised by different bodies. I just wanted to add, the only thing I just wanted to add to my report was just to say that, and I'm sure my non-executive directors will come in if I've missed one of the visits they've been on, please do that. But Mike Smith, who visited Pine View last week, was also accompanied by Brian, one of our governors as well. And I'm really glad to see those Governor Ned meetings visits now happening. And it's been a real journey as we've moved out of lockdown restrictions to enable that to happen. So I won't add any more. Any questions to my report, please? Oh, hang on, I've just got something come up. Excuse me. Nope. Okay, thank you very much indeed. Then we can move on to Michelle's report, Chief Exec's report.
Yeah, thanks, Chair. Good morning, everybody. Again, I'll keep it short. The report's there. I'm sure people have had a chance to read it. I'll start by obviously following on from the Chair in relation to the Health Service Journal Awards. It was fantastic to be there. Well done to everybody, especially the 2 highly commended, but everybody, it's just been great being shortlisted. The 3 words in my report, the STARS team, which is a real achievement. I mean, it's an achievement getting there anyway, but the STARS team are a very new team and making a real difference in rehabilitation services. So that was fantastic. And then obviously congratulations to our communication team for the unbelievable work, which follows on a little bit from what we were talking about with Gemma earlier, and our partnership work on children and young people. So I think it was a really rounded awards. And just to say thank you to Pete Beckwith, our finance director, who's now got a trophy cabinet at our new HQ building. That has taken some doing, I may add, but we will be populating that with the numerous awards that we've won from across the organisation. And that's really important. It's actually important for the board, it's important for staff, and it's about that being Humber and just recognising the fantastic work that our staff are doing in really challenging situations. We're going to come on to, you know, the winter pressures, or we're going to say the seasonal pressures. It's not, it's just the continued challenges within the system and the organisation. But to continue that transformation work that's making a real difference to patients and staff lives is amazing. So it'd be great to see that trophy cabinet filled up, and we will do that. There are 3 policies to agree, which I'll come back onto in a second. I do want to reiterate. I know it's in Hillary's report, but the Oliver McGowan training, please, all the board members, if you've not done it already, please get yourselves onto that mandatory training. It is online. It is a great training programme. It is really, really interesting. So please have that completed. I will be looking and watching, as you know. The breastfeeding guardian, if you remember, I'm the breastfeeding guardian on the East Riding team. I've now taken on that responsibility due to my health visitor background on the whole side. So I'm continuing to work with the whole team, which is really interesting, and I'm really enjoying that. So we'll watch this space on that as they go to the UNICEF or work towards UNICEF Gold Award, which is really, really hard to get. We have got it on the East Riding side. We're one of the few areas in the country that have, but that's so important. And we talk about health inequalities, it all links together. There's a bit on there about system changes, which I won't go into. I will mention the new chief executive of NHS Professionals is Julian Harker. I know Julian exceptionally well, so I will be asking Julian if he wants to come and have some conversations with us when he gets his feet under the table. There's a little bit on there around the CQC, but I know we're doing more in the February board emerging sessions. And I'll draw your attention to the first time it's been in the report, which is the formal feedback from corporate affairs from Stella. I'm going to stop there. I'm sure we're going to go on to the winter challenges and the strikes. I'll leave that to Lynn. I think it'd be useful for Lynn just to give us a bit of an overview, if that's okay, Chair, on that, and anything else that people want to pick out through questions. Just to note at the end, we do need to agree those 3 policies, which are the apprenticeship policy, the OD change, and the engaging and deploying staff on short-term basis. Thanks, Chair. I'll let Lynn come if that's okay, because I think it is important just to give us that overview of where we're up to from an operational point of view, and then I'll throw it open for questions.
Okay, I've also got Hilary there who'd like to come in, I think, on something on the report too. So, Hilary, you were up first. Do you want to start first before Lynn, or?
Oh, yeah, with the
Hilary, your sound you're breaking up. Hilary, can I come back to you and we'll go to Lynn? Yeah. Thank you. Lynn.
Okay, thanks, Caroline. Can I just check that you can hear me okay?
You're perfect.
It's brilliant, okay.
Not that Hilary isn't perfect, it's the tech that's a problem, by the way.
The audio.
Over to you, Lynn.
Yes, thank you. So obviously our focus continues on our position around our winter plan. At the moment, obviously, the new initiatives that we've put in place to support our services with the existing and the expected pressures and challenges over the coming months too. We shared our winter plan at a sort of check and challenge event with our mental health collaborative colleagues recently. I think it's fair to say that it withstood scrutiny particularly well, which is great. But obviously, as ever, it's great to get people's views and opinions and challenges to that. Some of you will be aware already there has been a recent announcement for further national monies to support discharges. So we've been working with our place colleagues very closely around the position of that, supporting the schemes that have been developed, ensuring as well that our services are represented in those schemes. And I think it's fair to say that we've had to do a little bit of additional work, particularly to make sure that our mental health delayed transfers of care are sort of picked up in that work and initiatives. I'm also our SRO for assessing and addressing, obviously with my executive colleagues, the potential impact of industrial action. So I think we're in a good place. We have assessed that, and we've asked all of our service areas to review and update their business continuity plans in light of the prospect of industrial action. It's interesting, we've got Becky, obviously, who is one of my EPR managers who supports all of our work around business continuity. So it's great to have Becky here today. Becky and I and a few others were also participating in exercise Arctic Willow. So this is a national EPRR exercise led by our ICB yesterday, and it continues through the week actually, so we'll get some feedback when the exercise is complete. But that's around testing the system resilience around concurrent operational pressure, so the continuing high demands, COVID, flu, winter industrial action, and possibly the risk around energy supply over the winter as well. So that's felt like quite a robust exercise. That's given us opportunity to think about again our own planning in light of that. Our own pressures have remained fairly stable over the last month. We are at that Opal 2 position. We have seen a reduction in staff absences due to COVID. We've seen a reduction in our number of inpatients with COVID as well, although we do have one currently. System pressures, as the report says, are still extremely high. So we are still seeing those acute hospital trust pressures. Ambulance handover times are still problematic. Ambulance services are very stretched currently as well. So again, continue to make sure that we're doing all that we can through our planning to support the wider system pressures. But I'm happy to take any questions.
Thanks, Lynn. Just before we continue, just on the Oliver McGowan training, Hilary's put in the chat box that you need to leave about 1.5 hours to complete it, and it's not something about it's not straightforward when you sign out. So you could do it and end up signing it out and it won't log you. And Hilary's going to arrange for some more information to be sent round from comms about that. And just before we take some questions, I'm just on the two policies, organisational change, engagement, deployment of short-term staffing. In the chat box, I've just put up, Steve, if you could put the links for those into the chat box, that would be really helpful, I think, for non-executive directors, just to have sight of those as we're going to be ratifying them later on this item. Are there any other contributions from EMT members that they want to make? No, I can't see anybody. Any questions from any other member of the board or any members of the board? Mike.
Yeah, thanks. It's a really minor one. It's for Stella on page 37. We've got the pack, the board strategy work plan, and there's a strategic headings, and one of them, it says corporate strategy, then it says perf, and I just don't know what it means in that column.
Stella?
Yeah, that's just shortened for performance. It's just the area that it comes under.
Okay, is that all right, Mike?
Performance is that it's very muffled.
Performance, it's PERF, is it?
Performance. Yeah, brilliant. Thank you.
Cheers, Mike. Stuart.
Thank you. Lynn, one for you, if you wouldn't mind just elaborating a little bit. It's on page 35 of the pack. It's in your operational services pressures bit, and it's the paragraph on CAMS. Towards the end of the paragraph there, it says a proposal has been developed and supported to establish a new eating disorder community treatment service. Can you just tell me a bit more about that? Has it been developed and is being rolled out, or is it still in development?
So the position is, Stuart, is that initially the proposal that we were asked to develop and agreed was the right one through the collaborative was for a day treatment type facility, so a building-based facility. Evidence is emerging quite rapidly around eating disorders at the moment, which is great. So with the collaborative team, we're just reviewing that in light of evidence, as there may well be further evidence that an intensive home treatment model might be, or a combination of the two, quite honestly. So I guess where we are is we really want to make sure that we get the model clinically optimised for that. So that work is happening at pace. So my hope and expectation is that we will be ready to roll out in Q4 as that progresses.
Thank you.
Thank you, Lynn. Francis.
Thanks, Chair. Just two minor ones in the comms section. Just wonder where we'd got to on the social values report. It's mentioned in there, and then on wishes, as we had that discussion in our NED meeting the other week about how we can raise the awareness of wishes and get more wishes in. And I just wondered if there was much in for Christmas from a wishes perspective.
Yeah, I can pick up both of those. We're doing, if you pick up the latter and work backwards, we're doing quite a big comms piece for wishes for Christmas in relationship to Christmas decorations, all that type of thing, Francis. I know that comms team are working closely with Claire Woodward from Health Stars. I spoke to them both last week, and I spoke to Claire on Monday, so I think that's in hand. So I don't know if there's uptake yet, but we're expecting to see a bit of an uptake over the next week or so, but I will put that in the board pack for next time. In relationship to the communication, so what was the question again, Francis?
Well, when I was at, for example, when I was at Millview the other day, we were chatting to them, and they didn't seem to be aware about wishes, and we explained how easy it was. Yeah. And they said, "Oh, right, well, we'll put something in." It just seems the message still doesn't quite got out there about what to do and how to do it.
Yeah, I think that's why we're doing the comms piece, because and also people don't always look at emails, even though we're doing the global communication, etc. So we're looking at different ways that we can verbally communicate that as well. So I've mentioned it in my vlog, for example. We'll mention it on Ask the Exec next time. So we're trying to get it out as much as in different ways as we can, not just for the Christmas, not for Christmas, but for that longer term piece as well. So I did speak to Claire, and so that was one of the number priority that we needed to crack on with, and I'm sure it'll pick up at the Charitable Funds Committee next time. But I don't know the exact number if they're coming in, but we'll keep an eye on that.
Okay, one of the suggestions I made was if we all had some forms when we're out and about on visits, we could actually give them the form there and
Yeah.
then and say,
yeah, we could do that. Yeah, I'll sort that out with Katie. Somehow see how we can do that. Maybe we can email them across and you can print them off. That's a good idea. Yeah.
Thanks.
Is that okay?
Thanks.
Yeah.
yeah, that's great, thanks.
Thanks, Francis. Right, okay. I haven't got any more hands up on my screen. Steve.
Yeah, thanks, Caroline. Just to flag up that the bit that was in my update about the time to hire being the 5th best across the whole of the northeastern Yorkshire region. I think that's worth recognising. You know, that team does come under scrutiny every now and again in the recruitment team. So I think it's fantastic performance that they've done over in really difficult and trying times to be there and making sure that we're getting people in as quickly as possible. So I just wanted to flag that up. Thanks.
Thanks, Steve. Steve, have you been able to get the links for the 2 reports on organisational change and short-term staffing that we're ratifying?
Not a minute, but I will get to it. Yeah.
If we can, because it'd be, I think Ned would like to sort of at least to sort of see them if we're ratifying a rewrite and changing policy. Okay, Mike.
Apologies, Steve, if I've missed it, but what is the number for time to hire? What's the flashbang time?
We were at, I think it was 51 days, Mike.
And that's from vacancy to recruit, or from interview to recruit?
From vacancy to recruit.
Brilliant, well done, thank you.
No worries.
Yeah, it's very positive, very positive. Right, okay. I just want to flag up actually on that. I think the vaccination work is brilliant as well. It was really good to see those high numbers and also comparisons to other trusts as well, both in mental health, but also across the piece in our region too. So that's really, really good to see. Michelle.
Yeah, it was a remiss of me. I should have mentioned that we've had a couple of national shout outs in relationship to being very, very high uptake of COVID and flu. And again, that's not about being top of the league table. It's obviously helpful. We want to be that, but it's about actually the fact that our staff are protecting themselves, their patients and their communities, which is fantastic. But also, I just didn't answer Francis' question about social values. The report is more or less completed. We've changed the storyboard a little bit. We wanted to do something that was animated, and we just had some technical issues with the initial storyboard. So I spoke to Rachel last week, and that is more or less concluded. So we should have it, hopefully, through the relevant governance processes, hopefully to the January board, if not to the emerging sessions in February, and then we can put it on the board the month after.
Thanks for that extra detail there, Michelle. And right, okay, I've come to the end of my list of... Steve, you still got your hand up? Okay, thank you. Right, okay, now that's the end of the Chief Exec's report. Now there are some trust policies to ratify. As we've already mentioned, there's a couple there which I think it's really helpful for. I know this is approved by the EMT, but it's ratified. It would be great, I think, for the non-executive directors to have copies of those reports. If we can, subject to getting those links before the end of our deliberations today, let's ratify those policies if the board is agreed. Are people happy to ratify the apprenticeships, organisational change, engagement and deployment of short-term staffing? Great, thank you. Thumbs up, no thumbs down. Good to see. Thank you very much for that. Thank you for to Michelle and the EMT for that report today. And we move on now to publications and highlights report. Michelle.
Yes, thanks, Chair. Again, this is just for information about the major pieces of publications that come out. I will draw your attention to the COVID inquiry, because obviously that is stepping up now in relationship to ask of the organisation. The Corporate Affairs Stella is the SRO for that, obviously working closely with myself. We did say we'd keep reviewing it from a resource point of view, which we will do, but there is a bit of an update in the report. And Lynn's already mentioned Arctic Willow on the work that we're doing in relationship to industrial action. And just to pick up some of the things in the chat box that I know have been responded to, it's not just necessarily around our our clinical staff or our staff in relationship to strike. It's the wider system, because as we know, there's Royal Mail, there's trains, there's potential school closures, so there's quite a lot. So we're trying to look at how we can look at what is the worst case scenario and work back from that in relationship to the total strikes. And we've got a list of dates, etc., etc. So just to give a bit of reassurance to the board at this stage, we're not just looking at it from an internal organisation point of view, but a wider systems issue and like supplies, etc. Thanks, Chair. Again, I'll answer any questions if there's anything on the publications report.
Thank you, Michelle. Any questions to Michelle or comments? No. Okay, then let's move on to the performance report. Pete.
Sorry, Karen, I did have a question on
Stuart, my apologies. Stuart,
it's a bit
sorry.
late with the hand raising there.
No,
so
sorry.
on the publications report, it's just for my understanding, it's on page 56. I think I'm just trying to understand the flow of the text in blue. It's relating to the state of care 21-22, and there's a statement in blue font, and it might be under your name, Hilary, but it makes a statement saying understanding the healthcare needs of local people is paramount for integrated care systems, etc., to maintain and develop the required workforce, etc. Is that a statement from the report, or is that your statement, Hilary, that's about the things that we have to do? First question.
Well, both actually. Is my sound okay now?
Yeah.
Both. It's lifted from the report, obviously where the report is targeting, but yeah, we have to work within that integrated system to try to overcome what is really a very depressing read, actually, in terms of the state of the NHS. But we've got to work in partnership. Yeah.
And so my thanks for that. So my follow-up question is really: are you, from where you stand at the moment, thinking about the way we've framed our strategy and all the things we've got in place? Do you feel we're doing even though it's quite difficult, particularly in terms of workforce availability? Do you think we're setting up ourselves to do the right things to pursue that ambition? Or is the things missing from your perspective?
At this moment, with the way the strategy is written and the current state of where the ICS is in getting involved, etc., I think we are where we are. We're all working together, working in partnership. Obviously, Michelle and Lynn are absolutely key in that as well.
Yeah.
More and more meetings now with the ICS, certainly from a personal perspective, I've got so many now, and it's looking at the system, it's looking at how we work together. What we've just talked about with the strikes and everything, there's so much work going on at the moment about partnership as well. So all that links into our strategy as well around the partnership and collaboration. And obviously when we've written that strategy, we've written it with the mind, haven't we, that ICSs are there and it's about system working now. So I'm quite sure we will, as we go through this journey, keep looking at that strategy to make sure it's fit for purpose for the following years to come as everything evolves. But I think at the moment we're in a good position.
Yeah, thanks. And I raise that, colleagues, because I think that there is a lot in the statements being made by us and at system level about the things that we need to do, and everyone kind of agrees wildly about the imperative to do something. I think what we need to make sure we're doing as a board is keep checking whether we're actually making progress, because otherwise we'll simply continue to have the conversation about saying we ought to do X, Y, and Z, and then keep checking whether the things we're doing are really working or not, and maybe, just keep an eye on that, because the reason I'll come back to this later in my report back from the audit committee in relation to our supply chain. I'll pick that up there about how we identify things that need dealing with. We say how we're going to deal with them, but it's very difficult to make progress, I think, on a number of fronts, and those kind of difficulties are kind of all coalescing around us at the moment. And I just think as a board, we just need to make sure we keep checking, are we really doing the right things here?
Thank you, Stuart, and absolutely important point. Identifying what we have to deal with is one thing. Checking whether actually our strategies to do that are working is another matter, and it always needs reflecting on, I think, on a regular basis. Thank you for that, and Hilary.
And thanks, Hilary, as well for answering that question.
Thank you, Hilary. Okay, thank you. I can't see anybody else's hands up on this item, so if we could move to the performance report. Pete.
Thanks, Caroline. So this is the performance report that takes us to the end of October.
Oh, Pete, you're crackling.
Right, just give me 1 minute, then I'll switch to me headphones, Caroline, just a sec.
Thank you very much.
Is that better, Caroline?
That is a lot better. Thank you very much.
Yeah. I didn't want to wear my headphones because I think with my moustache I look like a World War II pilot, but hey ho, it's the end of November, isn't it? So it'll be gone tomorrow. So apologies, I'll start again. So this is the performance report that takes us to the end of October now. Within the packet Appendix B, there's an update on waiting times. If I can I draw the board's attention to the safer staffing dashboard? And we sent a note last night to identify that the occupancy at Millview Lodge should actually be 99% and not the 111% that was in the papers circulated. That was just due to a bed that reopened at the beginning of September. So we've corrected that going forward, and we've actually corrected the public record of the board papers. I will take the bulk of the report as read, but if I can just pull out a few areas before we move to questions. So a full review across all divisions underway to understand the current CPA performance and recovery plans. We have had some out of area bed uses in October, but it is relatively low compared to earlier in the year, and obviously that links with delayed transfers of care, which I know is a continued area of focus at the Integrated Care Board. And I guess there's a couple of positives in there that our IAPT performance for both 6 and 18 weeks are above target, which is good to see that recovery. And likewise, at trust level, we continue to have strong performance on our statutory and mandatory training compliance. So whistle stop talk from me, Caroline, but bulk of the report will be read, and I suggest we just go straight to questions.
Thanks, Pete, and for clarifying that issue on the dashboard as well. Any questions to Pete? I've seen Mike first, please.
I suppose, Pete's just the messenger. My question is about the friends and family test. Minor one, that and the next one have got executive lead John Burns, so that needs changing. But the substantive question is about the GPs and how this triangulates with the information we got about access to GPs and the phone system. And I suppose I have heard it in other places, but do we have a plan in terms of GPs? Do we know what it is that's driving patients to not answer positively to the friends and family? Don't know who wants to take that.
Who would like to deal with that? Lynn? Or is it?
John Byrne.
Between me and
Kwame.
I'm looking at Kwame first, sorry, Chair, and then okay. I'm happy to come in.
Okay, Kwame.
So what we did was that we looked at all the friends and family at the report, and we looked at the top ones which were doing well and the bottom ones which especially include access. What was important is that when patients saw our staff, they were all very satisfied. So we were scoring very high in face-to-face contact. So the services have developed a plan to make sure that the access is improved, and it would include technology, employing more receptionists to be able to pick up calls, and to have a system of navigators who support with triaging. So the action plan went to ODG the last time with Mandy and Igba supporting that. So I'm hoping that when we have the next report, which I started with Mandy and myself supporting it using the FFTA electronic way of monitoring, that we would be able to get an improvement in access. I hope that answers your question, Mike.
Yeah, thank you. Thank you, Kwame.
Okay, thank you, Kwame. I'm moving on to Francis.
Thanks, Chair. One was a well done, just to look at the really good work that's been done on the 52-week adult paediatric and CAMS. To see those going the right way is well done. So we ask a lot of questions either way, but it's good to praise when people are doing well. And then I was just wondering on the safer staffing dashboard, the training on BLS seems to be a continuing issue. I just wonder where we were on that.
Thank you, Francis. Who'd like to pick up on that question? Hilary.
Yeah, we get monthly report on it, Francis, and it is a BLS that's resource training has doubled in the trainers, so they're getting out there, they're getting out to the units. So the Workforce Committee's asked for an update from that at its next meeting, and I hope to give quite a positive picture on that at the next meeting.
Thanks very much, Hilary. Philip.
Yeah, mine is just a question about the sort of memory diagnosis on page 74 of the pack. We just seem to be struggling to reduce the over 18 weeks from referral times. We made a little bit of impact, but it sort of stabilises the inaction plan.
Lynn, is that for you?
Yeah, there absolutely is, Philip, very detailed recovery plans around memory assessment service. The issue predominantly is an issue in Hull as opposed to East Riding. There is an issue. We have produced a recovery trajectory, and there is a resource implication for this one. It is something that we're discussing with our commission